Here at Fort Napier Hospital, we have an outpatient department for children and adolescents. So that is from young children up until the age of 18. Those ones are on outpatient, so we don't admit those children here, but we see them on an outpatient basis. Then we also do forensic assessments. So those are assessments for courts on an outpatient basis. We get the referrals from the court, so we'll do the Child Justice Act assessments, so to assess for criminal capacity. And then we also do assessments for assessing for competency to testify in court for the victims as well. And then we also have psychology services which we provide to the inpatients that are the state patients that are admitted in the hospital, because Fort Napier, unlike the other psychiatric hospital, we admit state patients. So those are patients that have been referred for court for admission. So mental health is very important as much as the physical health as well. So it's very important for one to care for their mental health. Mental health, in terms of caring for it, you need to be aware of your own mental health. So it's very important to be aware of what's happening with you, the changes that's happening with you. Sometimes what may seem like normal for other people may not necessarily be normal for you. So for example, how you react to situations. So don't compare yourself to other people. If you're going through something that you're finding difficult to cope with, seek help. Seek help from a professional, whether it's a psychologist or a counselor or a social worker. But it's very important to be aware of the changes that are happening and don't feel ashamed of actually seeking help. Whether you are young, whether you're old, whether you're male, whether you're female, it's very important to get help. And when you do get the help, it's important as well for us as people and our families to support those that are currently struggling with the mental health and to have the knowledge as well. So if I have someone in the family that has recently been diagnosed, for example, with bipolar or depression, it's also my responsibility to have an understanding of what's happening with them. So even if it's supporting them when they are going for those appointments or supporting them in taking their treatment, if they have been given treatment, it's very important. And for us, especially in our communities, to understand that having a mental illness is normal, and seeking help, it doesn't mean that you are weak, because it takes a lot of strength for you to actually say there's something not okay with me and let me go for help.